Systemic lupus erythematosus, SLE, commonly known as lupus, is an autoimmune disease that can affect various organs and tissues in the body. Symptoms can vary widely and may come and go over time. Some common symptoms of lupus include fatigue, fever, joint pain, stiffness, and swelling. Skin rashes, especially on the face and neck. Sensitivity to sunlight. Chest pain and shortness of breath. Headaches, confusion, and memory loss. Raynaud's phenomenon, which causes fingers and toes to turn white or blue in response to cold or stress. Mouth or nose sores. Hair loss. Swollen lymph nodes. Nausea and vomiting. Abdominal pain and diarrhea. The exact cause of lupus is still unknown, but it is believed to develop from a combination of genetic, environmental, and hormonal factors. Here are some of the potential factors that can contribute to the development of lupus. 1. Genetics. Lupus tends to run in families, which suggests that certain genes may increase the risk of developing the disease. 2. Environmental triggers. Exposure to certain environmental factors, such as ultraviolet light, infections, and medications, may trigger lupus in people who are genetically susceptible to the disease. 3. Hormonal changes. Lupus is more common in women than in men, and the symptoms of the disease tend to flare up during times of hormonal changes, such as during pregnancy or menstrual periods. 4. Immune system dysfunction. Lupus occurs when the body's immune system becomes overactive and attacks its own healthy tissues and organs. The exact reason why this happens is still unknown. 5. Other medical conditions. Some medical conditions, such as viral infections or certain types of cancer, may also increase the risk of developing lupus. In general, lupus is a complex and multifaceted disease that can have a variety of triggers and causes. If you suspect that you may have lupus, it's important to speak with your doctor to get a proper diagnosis and treatment plan. Lupus can develop at any age, but it most commonly appears in people between the ages of 15 and 45. In fact, about 90% of lupus cases are diagnosed in women of childbearing age. However, lupus can also develop in children and older adults. In children, lupus tends to be more severe and affect multiple organ systems. In older adults, lupus may be more difficult to diagnose due to overlapping symptoms with other age-related conditions. It's important to note that lupus is a complex disease with a wide range of symptoms and severity, and it can affect people of any age, gender, or ethnicity. If you suspect that you may have lupus, it's important to speak with your doctor to get a proper diagnosis and treatment plan. Currently, there is no cure for lupus. However, there are various treatments available that can help manage the symptoms and improve the quality of life for people with lupus. The treatment plan for lupus will depend on the individual's symptoms, disease severity, and other factors, and may involve a combination of medications, lifestyle changes, and other therapies. Some of the common medications used to treat lupus include nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, immunosuppressants, and antimalarials. These medications can help reduce inflammation, control the immune system, and manage symptoms such as joint pain, skin rashes, and fatigue. In addition to medication, lifestyle changes can also be helpful in managing lupus symptoms. This may include getting regular exercise, maintaining a healthy diet, avoiding exposure to sunlight, and managing stress. Support groups and counseling can also be helpful for people with lupus and their families. These resources can provide information, emotional support, and a sense of community for people living with this challenging condition. It's important to work closely with a healthcare provider to develop an individualized treatment plan for lupus. This may involve regular checkups and monitoring of symptoms to ensure that the treatment plan is effective and adjustments can be made as necessary. With proper treatment and management, many people with lupus are able to live full and active lives.